Welcome to Modes of Mechanical Ventilation Part 4, and we're going to talk about Synchronized Intermittent Mandatory Ventilation, also known as SIMV. This is probably the most common mode of ventilation that's used today. Now, if you ask my opinion, it was really great when it first came out. I think there are plenty of other modes that are superior than this at this point, but it is the most common one used. And again, being said, it's not just my opinion. I've been at hospitals where they actually had a sign above the door that said this is not a mode of ventilation. In other words, they hated it so much they just simply wouldn't use it. And I don't think I would go that far. I think it definitely has its purpose, but I think there are superior modes that exist in today's world of mechanical ventilation. That being said, let's just get right into it. So really what this mode means, we've left the control modes and we've gone into what we would call the supportive modes. So when a patient now breathes above the set respiratory rate in SIMV, instead of the breath being controlled like it was before in the other videos when we talked about controlled ventilation, it's now going to be supportive. Well, what does that mean? It means that the vent's going to help support or augment the work of breathing, allowing the patient to do a little bit more of work themselves. This mode is more commonly used for, quote, weaning or liberating the patient from the ventilator. So basically in SIMV, there's going to be two types of breaths that are going to be delivered to your patient. The controlled breath. Now in most ventilators, you can choose the controlled breath, so it can be pressure control, volume control, or PRVC. When this was first developed, you could only use volume control. Like I said, most ventilators, I think, allow either one of these delivery styles to be used. So they can either use that for the controlled breath, and then if the patient's spontaneously breathing, there's a pressure-supported breath. So two types of breaths that are being delivered. And once again, because I just love to duplicate myself, SIMV can be pressure, volume, or PRVC. And this is maybe the way it looks like actually on the machine. So if you look at the modes of ventilation, you'll see it say SIMV volume control, SIMV pressure control, or SIMV PRVC. Furthermore, it actually might say SIMV plus pressure support in volume control, SIMV plus pressure support in pressure control, or SIMV plus PRVC. That's what it might look like on the ventilator. I've got a lot of pets, and I think they're all named Peeve. One of my pet peeves when I hear people give a report on someone on SIMV is this. You'll hear people say, my patient's on SIMV plus pressure support. And they say that because that's typically what the machine says for the mode. But by definition, SIMV has pressure support. So when you're telling someone, or someone like me, a seasoned therapist, hey, the patient's on SIMV plus pressure support, that goes without saying. You don't have to say plus pressure support. It's kind of repeating itself, okay? We know by definition that it has it in there. So to simplify this even further, let's go into a detailed explanation. So if you have a patient in SIMV with a set respiratory rate of 12 breaths per minute, and the patient's breathing 16 times a minute, then 12 of those breaths are going to be controlled. 4 is going to be pressure-supported breaths. Now, it's really cool, too. Remember, the key word in this is synchronized. So what the machine does, if you have a set respiratory rate of 12 breaths per minute, well, there's 60 seconds in a minute, that means every 5 seconds the machine knows it has to give a controlled breath. The machine synchronizes itself. So if it gives a breath right now, and it's waiting for 5 seconds to give the next one, and let's say at second number 3, the patient takes a breath, that machine's not going to give another breath 2 seconds later. That would be very uncomfortable for the patient. It basically resets itself at 5 seconds so that way it can synchronize with the patient, thus making this a lot more comfortable for them. So pressure support is a setting on the ventilator. It is an actual pressure support setting that just helps the patient with the work of breathing on their spontaneous breaths. Okay, so think about this. Your patient, when they first get on the vent, they're either sick or injured or both, and they're probably on a lot of sedation. So when they first are able to take a spontaneous breath, because perhaps you're weaning that sedation, that first breath may be very small. They may be very weak because the sedation still's on board, so that's going to make the breath smaller. And it may hurt or whatever the case may be. Maybe their lungs are stiff or non-compliant because of an issue. Whatever the case, it could be very small. So the pressure support setting initially may be very high. As they get stronger, then we can start weaning that support down. Another way I like to describe it, it's kind of like crutches. So anybody who knows me knows I'm uncoordinated as all get out. If you take me to a ski slope, there is no way I'm not getting out that slope without breaking every bone in my body. So what happens if I shatter my legs, you go to the doctor, he puts a cast on that says, okay, here's crutches. So I know you have no coordination whatsoever. Now I'm going to give you crutches because you couldn't go on skis. There's no way you're going to get hurt with crutches, right? But they give you crutches, and they say don't put any weight on that injured leg at all. And as you get stronger and you go back for follow-up visits, they see that the bone is setting. They say, okay, I want you to put a little bit more weight on that leg, thus using the crutches less. And so on and so on. As that leg gets stronger, eventually you don't need those crutches. That's how pressure support is. It's the crutches for the lungs. So the next mode of ventilation we're going to talk about is actually pressure support ventilation, or CPAP pressure support. And this is a spontaneous mode of ventilation. In other words, the patient must be breathing spontaneously to stay in this particular mode of ventilation. And the primary settings that you're going to set for this mode will be PEEP, pressure support, and FiO2. They're really the only parameters you're going to set. And once again, here are just some of those sample settings. So maybe we set the pressure support at 10 centimeters of pressure, PEEP at 5, and an FiO2 of 40%. So just basic sample settings. You don't see a set rate anymore. Because it's spontaneous mode, this machine will not be delivering a rate. The rate's totally dependent upon the patient themselves. So some important things you need to know about pressure support. Now, once again, this is a spontaneous mode of ventilation. There is no set respiratory rate. The patient drives all the ventilation on their own. For this reason, they really need to be fully awake in order to be in this mode. Now, there is a setting in there, an apnea setting. It's based on seconds, and your apnea alarm should not be set for probably more than 20 seconds. In other words, if the patient makes no attempt to breathe whatsoever within that 20 seconds, the machine will go into a backup rate, a backup mode. That's a safety feature to protect your patient, all right? And here's something that I've seen on a very regular basis, and I know a lot of people have seen this, and some of you listening to this video can definitely relate. The physicians are very excited to wean our patients off mechanical ventilation, and they insist that we should put the patient pressure support even though they may not be fully awake. And they continue to go up into backup ventilation. Of course, the alarms start going off the vent. It's very annoying. And you tell the physician, look, they keep going in a backup. I think we need to go back on a rate. And you hear them say, just kick the bed or shake the bed, shake the patient, keep them awake. Let me tell you this, if you have to kick the bed or shake the patient to make them breathe, you're in the wrong mode of ventilation. If we keep doing this, what's going to happen, all these periods of 20 seconds of apnea, the patient's going to decompensate. And what that really means when a patient decompensates is they're de-recruiting their alveoli. We're going to have to re-recruit these at some point. And it's these re-recruitment maneuvers that often causes shearing damage to the airways that leads to ARDS. That's a bad thing. So if we have to kick the bed or shake the patient, or kick the patient and shake the bed, whatever you want to do, don't be in this mode of ventilation. Wrong answer. Now, the last mode of ventilation that we're going to cover during this whole series of basic ventilator modes is volume support. Now, this is also a spontaneous mode of ventilation similar to pressure support, but it works kind of like PRVC does, except in the support world. So what happens in this mode is we put the patient in this mode. Instead of setting a pressure support, we're going to set a targeted tidal volume. In other words, a tidal volume we want the patient to achieve with each spontaneous breath. And what the machine is now going to do is it's going to measure the return volumes coming from your patient, and it's going to adjust the pressure support for us, up and or down by about +2 centimeters of pressure, up or down depending on what the volumes are. Okay, we're still going to set PEEP and FiO2 just like before, but the machine will set the support level for us. Okay, it's the only difference between this and pressure support. So here are some sample settings in volume support. And as you can see, we don't have a pressure support setting anymore. Instead, we have a tidal volume. And remember, that's a targeted tidal volume. In this case, we're picking 500, which means what we're asking the patient to do is with each spontaneous breath to achieve this particular tidal volume. And the machine will adjust the pressure support accordingly. Okay, real simple sample settings. Simple sample. That's a difficult thing to say. What I want to do is do a little comparison of volume support versus pressure support. It seems that most places, most institutions use pressure support ventilation, and many people have no idea really what volume support is or what it does or why they may want to use that over pressure support. Now, pressure support, of course, guarantees that you can have a set overall peak inspiratory pressure. So if you're concerned with high pressures, this is going to help protect those pressures from getting too high. And you can also use this mode if you're doing a spontaneous breathing trial. You can't use volume support if you want to do this. What's a spontaneous breathing trial? Typically what happens is this is coordinated between nursing and respiratory. They'll usually lighten the sedation on the patient. At the same time, you put your patient in pressure support. You turn the pressure support completely to 0, so all they're getting is CPAP or PEEP, and we see how the patient does. All right? You can't do that in volume support. And the problem with pressure support now is it may allow the patient to decompensate if they get tired. So what happens? We set the pressure support based on a tidal volume we'd like to see the patient get. So let's say we set the pressure support at 5 or 10 centimeters, whatever. Okay, and you leave the room. You go on what we call a trial. We're doing a pressure support trial. And initially their tidal volumes may be very large, but as they start to get tired, those tidal volumes will start to decrease because the patient needs more support as they wear out. And as the tidal volumes decrease, inevitably what may happen if someone doesn't notice this in time is they may decompensate or de-recruit, as we talked about before. And then what happens is they start to show clinical manifestations such as desaturating, increased heart rate, increased respiratory rate, increased work of breathing. And that's when we notice there's a problem and we switch them back to the mode they were previously in. Usually by the time we do this, it's too late. They've already decompensated a bit, which is not a good thing. Now in volume support, you're guaranteed a set tidal volume. You get volume targeted ventilation. And it helps to protect against decompensating. Why is that? Because now if the patient starts to wear out and the tidal volumes start to drop, the machine will immediately start to increase the pressure support to meet those increased demands from the patient. However, since we're not adjusting the pressure support, the machine is, we might not notice subtle changes in that support level, thus alerting us to the fact that they are getting tired. So you have to pay very close attention to your trending peak pressures. The other problem with volume support, though, is the machine can't define work of breathing. So what if the patient's working real hard to breathe and they're taking real big breaths in as they're working really hard? All the machine sees is these large tidal volumes, and it starts to decrease that pressure support when they need it the most. So that can be a very big problem with volume support, again, meaning that we have to really pay close attention to our patient. So this is basically it on the modes or basic modes of ventilation. It's a 4-part series. I hope you've enjoyed each one of them. Pretty soon you're going to find this on our website and you'll be able to take this as a course probably in the next 3 to 4 weeks. Now this video may be here for a very long time, so just so you know what that means, it's February of 2018. I'm hoping by March of 2018 to have this approved for CEUs by the AARC and on our website. So stay tuned. And as usual, we have to talk about our websites to direct you to the stuff that we have. www.$10ceu.ning.com is our social media platform. It's all free. There's blogs. There are the other links to our YouTube videos. You will find a discussion forum in there. All kinds of good free information. We try to provide as much free information as we can to you. The only thing you'll ever have to pay for from us is if you decide to take a CEU course. That's $10 for each CEU. And you can take those courses on $10ceu.com. Currently, there's only 3, okay? But the 4th one is coming, and that's the one on the modes of ventilation. And the nice thing about this is just a little tip for you, I should say. If you viewed all these on YouTube and you go to take that course, you won't have to watch that whole video. Just zip through it, speed through it. You know how you can kind of scroll past all of it and go right to the end? And when you get to the end, you have to take a quiz. That's required by the AARC. You'll have to take a quiz on the knowledge of what you've taken. It's going to be a very easy quiz, easy questions, and you can get that CEU really quick, okay? So just a little tip. Oh, and one more thing I really would like for you guys to do, if you could just hit like on these pages. If you like my content, you like the videos, click the little like button, the thumbs up button on the YouTube page here, so that way we get more notification. People can see more of what we have to offer. I would appreciate that. Thank you very much, and we'll talk to you all soon.